One interpersonal factor is Mr. Garcia's age. He is a 45-year-old patient. This can be a support to patient care as patient is in middle age, considering that there is lesser aging effects or complications that may hinder treatment. He may also be more physically capable and highly motivated that will aid his recovery after the surgery. The patient's wife and children are present at home. This psychosocial factor is a significant help towards patient care and recovery. Considering the wife works at night, she may be able to assist with patients' functions and exercises during the day. Mr. Garcia's children are preteen and teenagers, in which they present with independence and does not require much care from him, in which they can also help during early stages of recovery at home. A socioeconomic factor is the patient's job as a janitor. This may be a barrier to patient care due to the increased physical demands of the job. Following a laminectomy, precautions as to avoiding lifting, trunk bending, and twisting should be followed. Patient's job requires a lot of these activities and may affect patient's recovery, risking re-injury and complications. Patient has 17 steps to enter home and an additional 12 steps to access bedrooms. This is an environmental factor that may be a barrier to patient care. Having multiple stairs may be difficult during early stages of recovery due to pain and weakness post-op. There is also increased demands and spinal load that may increase risk for falls, strain, and may delay healing. One significant barrier presented in this case is language barrier. Knowing that Mr. Garcia speaks primarily in Spanish but understands and speaks little English, PTs and PTAs may assume that he can communicate and understand information regarding his condition when presented in English. If this isn't addressed, this may result in miscommunication, inadequate participation, poor understanding of condition, and significant risk to care and recovery. This may be avoided by ensuring which language the patient is more comfortable with, utilizing use of interpreters as needed, providing written handouts in Spanish, and use of simple language and instructions. One personal bias on limitations a healthcare provider may have is age bias. They may assume that older adult patients have lesser resilience, motivation, and participation compared to young adults. This can be minimized by properly assessing patients' potential, individualized capabilities based on specific health status following surgery, rather than generalizing and making assumptions based on age.